Lord Dole question, Lord Young of Norwood Green.
My Lords, I beg leave to move the question standing in my name.
NHS England Improvement have allocated £150 million of additional funding to ambulance services to help address pressures alongside reducing ambulance handover delays. And even though the pandemic placed significant pressure on response times, there has been improvements in all response time categories in both April and May, with average Category 2 responses to emergency calls, such as strokes and heart attacks, reduced by about 11 minutes 24 seconds in May alone. Work continues with the service to restore performance.
My Lords, I feel it difficult to say I thank the Honourable Lord the Minister for the answer, because it's a totally unsatisfactory answer. I've been raising this question for about the last 6 months, and the reality is that if, as Baroness Udin told me when her son had a stroke and 999 was called, it took nearly 6 hours, and he suffered as a result of that serious consequences. People are dying as we sit in this chamber, literally thousands of them. And why? Because paramedics are waiting, would you believe it, by hospital trolleys in the hospital, waiting for a bed. There is a simple solution to this problem, which I've been suggesting to the Noble Lord the Minister. I've also given him a place, Wolverhampton, where they have solved this problem. And yet still, we don't seem to treat this as a matter of urgency. It's a national disgrace. And I want an assurance from the Minister that there is real action to be taken. And that doesn't mean an 11-minute improvement.
Well, can I begin by thanking the Noble Lord for the Noble Lord's engagement with me and the Department on this particular issue. And when the Noble Lord has sent me details or suggestions, I have passed them on to the relevant officials within the Department, and I hope I can assure the Noble Lord that I have done that. As the Noble Lord will know, within departments we have particular portfolios, and I have to hand it on to the particular person responsible. But in terms of the recovery plan, the NHS has published an urgent and emergency care recovery 10 action point plan. I won't go through all the action plans, but it includes dealing with paramedics, recruitment, retention, also more space in A&E departments. At the same time also, can you handle that particular request by telephone and get them to speak to a clinician and divert them to a more appropriate resource? So all these are being looked at. I understand the Noble Lord thinks it's unsatisfactory, but we have been hit by the pandemic. We are trying to recover that, and there is a plan.
My Lords, the Noble Lord Young is right that handover times have a particular impact on ambulance services, and I was pleased to hear the Minister mention recruitment and retention in A&E departments. This is a long-standing problem in emergency services. The Royal College of Emergency Medicine states that emergency medicine has a high attrition rate. I know a number of steps have been set out. Could the Minister state what success they are having, and if they are not succeeding yet, what further steps the government plans to set out, because we need a change in direction as soon as possible?
Well, I thank my noble friend for the question, but also the point that it has to be a number of different points in the system. So clearly there are recruitment campaigns for doctors and for nurses themselves. In addition, the number of ambulance and support staff has increased by almost 40% since 2010. The call handler numbers have also increased at the start of May 2022, got 400 more. In addition, there are pledges to increase the training of paramedic graduates nationally per annum by 3,000 per annum. So all these will take time to get into the system, still recovering from the pandemic.
Virtual contribution.
My Lords, when Sandra Francis of Oswestry had a cardiac arrest a few months ago, her son had to do 35 minutes of CPR, waiting for an ambulance delayed in handovers at A&E. Sadly, she died. Her son said, an ambulance should be a way of getting someone to hospital. It shouldn't be a waiting room sat at the hospital. He's right. Ambulance delays are the very visible part of the A&E crisis, the wider shortage of hospital beds, doctors and other healthcare professionals. So can I urge the Minister again, what is the government doing to remedy this much wider emergency that's causing preventable deaths right now?
Well, the Baroness will be aware that there are a number of things going on with the 10-point plan. and maybe I'll go through some of them now. Supporting 999 and 111 services, make sure that the appropriate person answers the call. Supporting primary care and community health services to manage those services. But more use of urgent treatment centres, more support for people and children and young people. Communication, sometimes they ring 999, but actually don't need an emergency, and they can be redirected to another clinician who can speak to them, and that takes pressure off. Recruiting more staff, looking at more prevention, and also looking at different rules that prevent the appropriate workflow through the system.
My Lords, some months ago, as my wife lay dying in my arms, I phoned the 999 services, and the man answering the call gave me a litany of questions, including to count the number of beats there were every minute between her heartbeat. That waste of time, of course, is critical when with a cardiac arrest you have only a few seconds. And I had to interrupt the cardiac massage that I was giving my wife until the services arrived, but of course they hadn't been called yet. When eventually he did back down, it was obvious that he had not been trained to ask the right questions. Can the Noble Lord assure the House that there is proper training for people who answer these calls in these critical times when they're dealing with a relative who may actually recognise that their close relative is dying and also can hear what they're saying on the telephone, that it is highly dangerous? That makes it very, very difficult. The last thing we hear as we die is usually the voice of somebody with us.
Well, can I begin by thanking the Noble Lord for sharing that very personal story? And clearly, there are too many incidents of this kind. And one of the issues we've got to be very careful about as we look to recruit more numbers, look at the system, how to divert calls to the less urgent ones. I think probably what happened in that case, the person was probably given a train to ask particular questions to ascertain how serious or how urgent it was. And sadly, clearly it was inappropriate. I will take that particular case back to the department and see if I can get some answers.
My Lords, whilst our prime objective must be to eliminate all these unacceptable delays as quickly as possible, I wonder if the Minister could confirm what work is being done in the interim to ensure effective pastoral care is available for those who are currently waiting for long periods in ambulances, particularly for the many for whom last rites and other rituals that take place at the point of death form an important part of their faith.
Well, the Right Reverend Prelate raises a very important issue for those of faith who want to be with someone where they can have share their last moments of life. I'm afraid I don't have a detailed answer, but I will go back to department and write to the Right Reverend Prelate.
My Lords, ambulance delays, as other Noble Lords have said, are a symptom of pressures elsewhere in the health and care system. At the end of April, 62% of over 20,000 patients in England who were medically fit to be discharged still remained in hospital. This was largely due to a lack of appropriate social care provision. So can the Noble Lord the Minister say how and when there will be a fully costed workforce plan to ensure that the relevant staff are in place in order to tackle this urgent bottleneck?
Well, the Noble Baroness will know from the debates we had during the Health and Social Care Bill that first of all, there is a 15-year plan. Health Education England have also been tasked with that. In addition, there are significant amounts of things being done at the local trust level. So it's not only just sort of a 5-year Soviet-type plan top-down, it's also at local level, looking at recruitment. And also, in addition, there's been a national discharge task force that works with the national government, local government, NHS, to identify long-term sustainable changes which would reduce delayed discharges and ensure patients are only in hospital for as long as they need to be.
My Lords, could I ask the Minister what role he thinks the police might have to play in this? Last Wednesday, I was knocked down in Great George Street by a bicycle and rendered unconscious. And although a paramedic arrived from St Thomas's by bicycle quite quickly, there was no ambulance. And I was very grateful to the police, therefore, for taking me into St Thomas's and depositing me at the A&E. I thought that was very helpful, and I wonder whether the Minister thinks that that might happen more often.
Well, first of all, I thank my noble friend for sharing that experience, but also it's good to see that my noble friend has recovered and is able to ask the question. One of the interesting things that is being looked at as part of the overall review, and once again I think we have to be very careful about unintended consequences, is how many of these cases can be actually treated at the scene without requiring the patient to be taken to hospital. that's going to be a very careful and very difficult trade-off. But particularly, obviously, in this case, clearly what they were looking at was the possibility of someone else taking it, and the Noble Friend was fortunate to have a police person close by who was able to do that. But what we've got to be careful with any of these interventions, we have to make sure that we're fully aware of the unintended consequences actually making it worse.